are at the EIP not only because of the tremendous opportunities of networking with many stakeholders. I think the EIP is a unique framework of collaboration of everybody involved in active and healthy aging, and especially in the B3 group in integrated care. So it's the first time that we have not a punctual collaboration, but really a framework in which all the stakeholders, so industry, providers, regions, academia, can sit together and tackle together the challenges of the transformation towards integrated care.
We thought that being in the backstage where the priorities are decided, it could influence the agenda, and we could drive the agenda at the EU level, orienting it towards our priorities, and therefore bringing that at home, being aware of what is going on at that level.
The strategic priorities of the B3 Action Group in Integrated Care actually haven't changed from our first action plan. We conducted a Delta questionnaire with 27 regions across Europe to formulate the first B3 action plan. And those regions identified a number of key priorities that they wanted to work on. And those are the priorities we've been working on for the last 3 years. We've just refreshed those again and actually found that they still remain very valid. So we're going to continue working on those as we move forward for the next 3 years. So those priorities, as Christina outlined, are around obviously the health and social care integration, so the legislation and the frameworks that support that integration at all levels. Also, as Christina also mentioned, about change management and the associated processes around that. But in addition, there are other things that can really contribute to the success of integration, and those are around the supporting infrastructure for ICT, which underpins some of the communications around successful integration. Also workforce development, which is very much linked to change management. So that's ensuring that all staff in all sectors, and indeed citizens and their carers, actually have the skills and capabilities to embrace this concept of integration.
So for the B3 Action Group, really the foundation and aspiration is the local implementation, and the group has really been working over the last 3 years to achieve this implementation in the European regions. And we've started with the mapping of good practices in the area of integrated care, which resulted in the collection of over 100 good practices in the area of integrated care. And in the second phase, we try to think about how we can change this evidence in the practical tools that can help the regions in the process of scaling up and replication of these integrated care solutions. So for that purpose, one of the biggest achievements of the group is what we call the B3 Meet-Treaty model, which is a self-assessment tools for the regions to assist them to assess how ready they are for the implementation of integrated care, but it's also a tool that facilitates knowledge transfer and then scaling up. And there are also a couple of practical, or I would say more topic-based outcomes, such as medical guidelines for respiratory diseases, a consensus-based framework for patient empowerment, organizational models, change management, as well as risk stratification tools. Another big aspect of our work has been the collaboration with the EU-funded projects. So we've contributed with our expertise, but also disseminating the findings of the EU-funded projects such as the ACT, Momentum, Smart Care or Beyond Silos project.
At this moment, I think that it's very important to raise awareness of at a political level. Politicians need to be more involved if we want to speed up process of changing management in the process of EIP. Maybe we need to label active and healthy aging, all the actions in the priorities framework of the EIP, and that could be a good idea to share objectives on that matter. And the second thing, and that is, I think is very important, is that this, starting a process of training processes among regions which work together and share experiences in this initiative could really speed up the process of scaling up, which is really the main aim of this initiative.
This is about citizens, it's about people, individuals, and not this label of patient. So that's again a very important aspect of personalised care and making sure that integration actually does empower individuals to self-manage their conditions and actually remain active, well and healthy for as long as they can.